So, welcome everyone. My name's Scott Welly, and on the other side of the camera here, you've got Dr. Nolan Mitchell. And go ahead and say a couple of words.
This is Dr. Nolan Mitchell. I work with Premier Sports and Spine Center in Eden Prairie.
Cool. Now, kind of my purpose for putting out some of these videos, and you'll see a few more of them coming up here in the coming weeks and months, is obviously now we are going into the off season of training for endurance athletes. And I'm just trying to put quality content out there from industry professionals and content that people can use to hopefully help them stay stronger, injury-free, so they can train better, train more effectively, and then make 2013 their best year ever. So with that being said, let's go ahead and go to it. Nolan, why don't you just tell people a little bit about who you are, what it is that you do, where you work, and kind of give them the Dr. Mitchell 101.
Okay. My name is, like I said, Dr. Nolan Mitchell. I work with Premier Sports and Spine in Eden Prairie. I'm a sports chiropractic physician, which basically means I went through chiropractic school and then I did a postdoctorate in sports medicine that allows me to have some different treatment options, some different diagnostic techniques, kind of a blend of chiropractic and PT and massage. At the clinic, we focus mostly on soft tissue injuries and especially overuse injuries, which is why we end up seeing a lot of runners. Runners tend to have overuse injuries, so we kind of honed our expertise in that area quite a bit.
Sure thing. You sound like a smart guy. Even I'm impressed. So, do you deal primarily with runners, or what's the most typical athlete that you usually see?
We do see a lot of runners. It seems like in the last couple of years, running has become such a big sport. There's more and more people that are getting into it, and there's more and more people that are getting into it at a higher level. There's more people that they're not just going out and running for the fun of it or for the exercise. They're competitive with it. They're the kind of weekend warrior has kind of gone by the wayside. It's more they're devoting a lot more time, a lot more training, and they're getting better at it, but it also can sometimes mean more injuries too.
Sure thing. Now, I think a lot of times people don't understand exactly why overuse injuries happen. Even from a lot of the athletes that I've worked with in the sport, I think sometimes they look at it and they're like, well, running, you're going to get injured at some point. It's just going to happen when you're running. And that's kind of the way that they look at it. Not really understanding, I think, the nature of overuse injuries and what exactly causes them. So can you educate people just a little bit on what causes overuse injuries?
Sure. I think that is a common way of thinking about it. And with most sports, people are going to run into injuries, but you want to kind of minimize that. Overuse injuries occur just because of the repetitive nature of running. Like taking one stride in and of itself is very low impact, it's very low stress. But if you run a mile or 10 miles or a marathon or an ultra marathon, that a small amount of stress gets repeated hundreds or thousands of times, and eventually it's going to start to break tissue down. And the nature of an overuse injury has to do with how the body heals. So as you break tissue down, your body has to heal it, and it goes through 3 steps. You get inflammatory phase where you get a little bit of pain, a little bit of aching maybe. That's a good thing. You want that to happen. It's your body's natural reaction, and then once that inflammation takes place, then there's a proliferative phase where scar tissue gets laid down. It's also a normal response, and then eventually that scar tissue gets remodeled back into muscle or tendon or whatever, and that's the 3rd phase. Overuse injuries happen because that 3rd phase is never allowed to happen. You get inflammation, you get scar tissue laid down, and then you go for another run.
Mm-hmm.
It never gets through that whole phase, and eventually it builds up and causes an overuse injury. And some of the more common ones, like a tendinosis or a fasciosis, would be more of the chronic type of overuse injuries.
Sure. And what are some of the most common overuse injuries that you see in runners or, I guess, triathletes?
Okay, we see a variety with distance athletes. It's earlier in the process, it's more of a tendinitis or a fasciitis. So it'll be like Achilles tendinitis or patellar tendinitis or plantar fasciitis. And that's just more of an inflammation. It's more of, earlier in that process. And eventually when that scar tissue gets to build up and that tissue is more and more broken down, it becomes a tendinosis or a fasciosis, like I was saying. That's So we see a lot of Achilles tendinosis, we see a lot of patellar tendinosis and plantar fasciosis. And then there's just a whole variety of hip problems. We see a lot of hip, like glute problems, IT band problems. Is every runner knows about the IT band. Long tissue that goes down the side of your thigh. We see a lot of problems with that. And a lot of them end up being kind of more complex than just the one location. They're due to biomechanics and they're due to weaknesses in one area or another.
Sure. Now, as far as overuse injuries go, I mean, one of my most difficult things as a coach is, when an athlete comes to me either already injured or pretty much on the brink of injury, because then I'm always playing a juggling act or a balancing act between trying to help that athlete build up their volume, add in some intensity that'll get them to be able to peak for their race, but at the same time, not causing further injury to what they already have. So I'm not sure if this is just a blatantly obvious question, but is there a marker that you use as far as, you talked about the different stages of an overuse injury, when someone is safe to be able to go out and, I get the question all the time, oh, Scott, this hurts. Should I go out and should I do a run today or should I go out and should I do something today? Is there kind of a marker that you use as far as telling people what they can and cannot do?
There can be. The hardest part of that question is it just kind of depends on the area of the body, too.
Mm-hmm.
So one of the biggest ones that I tell athletes, especially when they're close to a race or, they're in a situation where they want to be doing their sport, like high school athletes that's 2 weeks from state, or, they have a big game coming up where maybe they're going to push it more than they would if it was 2 weeks before training camp.
Sure.
If it's limiting performance,
mm-hmm.
Then that's more likely to be, quote unquote, an injury. So,
mm-hmm.
If you're just unable to run at the same pace, like I can, I'll hear people say, like, I can still run 5 miles, but I can't do it at a 7-minute pace anymore.
Right.
I'm okay if I keep it to 10 minutes. Then your performance is being limited, and you probably should either seek care or try and figure something out, or cross-train, or whatever the case may be.
Sure, right. I think that's great advice, too. Yeah, I mean, if you're not able to get that physiological benefit from whatever type of workout that you're doing because you're so limited as far as your injury goes, then it's really kind of pointless to even go out there and to do it in the first place. So, yeah, it's a good way of saying it. Okay, so we talked a little bit about overuse injuries. Now let's talk about some strategies and some words of wisdom that you have as far as preventing them, because that's kind of the holy grail, and that's what people really want to know. So why don't you go ahead and give kind of some strategies on what people can do?
I mean, the basic one, I talk about a lot with patients about the terrible twos. There's too much or too fast or too intense or too hard of a surface. So, a lot of people, they say, like, well, why did I get hurt? I didn't increase my mileage, but they increased their intensity too fast.
Mm-hmm.
If you're running 25 miles a week at a 12-minute mile pace, and then you're going to try and increase to the same amount of mileage but at a much faster pace,
mm-hmm.
that's a huge increase in stress.
Mm-hmm.
Just like we get people that, I was running 15 and then I tried to run 25 or I tried to run 35 or, these big increases tend to be when people get hurt. And a lot of times that's coming off another injury.
Sure.
You see a lot of people, they have plantar fasciitis or fasciosis, and then they get over it and they try and go back to where they were 5 weeks ago.
Sure.
So they go from 0 to 10 miles a week and they go back up to 50.
Right.
So big dramatic increases tend to cause a lot of problems. And that's the same thing with if you're running 25 miles a week on soft ground and you try and go to 25 miles a week on cement, mm-hmm. that's a huge increase in stress. You might want to back off a little bit, get used to running on the cement.
Mm-hmm.
Also true with like minimalist shoes.
Mm-hmm.
People that they were going 30 miles a week in regular shoes and they try and go to 30 miles a week in a pair of Vibrams, and that's also a big increase in stress.
And sorry, no, that was actually going to be the next thing. I'm glad you brought that up because I was going to transition into it. I'm sure there are some people listening to this right now that are minimalist shoe people. I have a couple pairs of Vibrams, and I do believe in doing some barefoot stuff. So why don't you give your take on that and where you stand on that side of the game?
My take is that it's really complicated. I think that the theory behind it, that the feet were designed to run with nothing between them and the ground. The musculature, if it's strong enough, can handle it. But you need to remember that if you're 30 years old, you've had 30 years in shoes, and your body has adapted to those shoes. So I tell people if they want to go into some Vibrams, that's a great thing. But maybe do a week at just walking, walk around in them for a while. Maybe start walking on grass. Work up into it. Don't just go from 30 miles a week in a pair of Nikes to 30 miles a week in a pair of minimalist shoes.
Sure.
You're kind of asking for an injury when you do that, but I think it is really good for running technique and running form. Form, just because you're getting overuse injury doesn't mean that you're running too much necessarily, as weird as that sounds. If you've got some biomechanical issue with weakness or form, it's going to put more stress on one specific area. But every other part of your body might be able to run that mileage, but that one spot has more stress, and so it has more breakdown, so it has more scar tissue, and so biomechanics and form also play a huge part.
Right, and that's usually the way that I come at it too. I mean, I always tell people you don't get injured because you run; you get injured because you run wrong. For the most part. I mean, I get the impact forces, but a lot of times people can do subtle form tweaks, I think, that minimize those impact forces and that really help people from a biomechanics standpoint. So what other strategies would you say? I like that, the terrible twos. I hadn't heard that before. But what other things would you recommend as far as preventing overuse injuries, especially in the off season?
Okay, especially in the off season, cross training and resistance training. There's a lot of research in the last little while has come out talking about how resistance training can not only prevent injuries but also make you a better runner. If you're the stronger you are, the more stable you are, the better you're going to be at no matter what sport you're playing. I work with a lot of volleyball players, and when they've got a strong core and strong stability, then they're not as nearly as likely to get hurt. And it's the same thing with runners. If you're stable throughout your core and throughout your glutes and your quads and your hamstrings, and all the ratios are correct, that's a big one to talk about, like quad to hamstring ratio. Getting stronger with resistance training makes a huge difference and can help prevent those injuries just because your body's able to take more stress. So if it can take more stress, then it doesn't have to do as much healing, and you don't get as much scar tissue, and you don't get as many injuries.
Sure. So as far as resistance training goes for people out there that, I've come across a lot of people, they either don't know what they should be doing from a resistance training standpoint, or maybe they don't see the value in it. Is there a starting point? Or, do you really start at the core and maybe the glutes and then branch out from there? Or what are your recommendations on a starting point for resistance training?
Yeah, I think for distance athletes, it should be mainly focused on the core and the hips and the glute area. But, with anybody, you want to kind of balance everything out. You want to be doing a lot of different types of exercises. With distance athletes, you don't necessarily need to go out and squat 300 pounds. You don't need to bench.
Really?
Press.
I thought you had to do that. That's what I get all my athletes to do.
Balancing that kind of stuff, it's more, you're an endurance athlete, so you do higher reps, you do lower weight. You don't necessarily need to go out and do Olympic lifting. You don't even necessarily need to go out and do, massive amounts of free weights. It's just stabilizing, high weight or high reps, and lower weight.
Sure. Yep. Okay. That's great advice. All right. Well, I won't keep you too much longer. Do you have any other great words of wisdom you would like to pass along before we sign off here?
No, I guess not really. I think the biggest thing, and it's not, I don't mean it as a self-promotional thing, but when you have an injury starting, the earlier you get it taken care of, the better. When you hear about runners being out for long periods of time, more often than not, they waited a really long time before they got any type of evaluation. I'm not even talking about care, I'm just talking about an evaluation, because sometimes people come in and it's like, just take 2 weeks off, ice it, rest it, should be fine. But, you'll hear people say, like, well, I haven't ran for 10 weeks because of plantar fasciitis, and you say, well, how long has it been bugging you? And they say 2 years. And it's, the longer you wait, the more difficult it is to get rid of, the more other problems are going to come up from it. If you've got a problem in your foot, then you're going to be running a little differently, and then we get into the whole form and biomechanics issue again, and more stress on different areas. So, not necessarily with me, but if you've got something bothering you, you're better off getting it looked at by somebody who's got the sports medicine training, who has the knowledge of kinesiology and biomechanics to figure out what the true problem is.
Right. And for everybody out there listening, please listen to what he just said. I'll be the first one to say that I'm as stubborn as anyone, stubborn German when it comes to whether you're sick or you're injured and you don't want to go in, you don't want to see anybody about it. But a lot of times if you don't get that nipped in the bud right away, it causes you 10 times the problems down the road. So if something's bothering you, don't try and work your way through it. Obviously, you know, I'm doing an interview with Nolan because I trust him. I've seen him. He's done some work, you know, for me before, and I know he's really good at what he does. So I will list all of his contact information below this video so you can get in touch with him if you are interested. And greatly appreciate your time, man. Thanks a lot.
Yeah, thank you very much.
All right.
Good off season and a great 2013.
All right. Sounds good. Have a great rest of the day.
Thank you.
Take care.